right. Knock, knock. My name is Sophie. I'm going to be your student nurse today. So I have got my items ready and I'm going to go ahead and set them on the table here. I'm going to make sure that I have a sharps container, my gloves, and then I'm going to do some hand hygiene. And now I'm going to introduce myself to the patient. I'm Sophie. I'm going to be your student nurse. And I'm going to check your wristband. Perfect. That matches with my order that I have. And then I'm going to ask which arm you prefer for your IV today. And you want me to use this arm? Great. Can you tell me, do you have any allergies to any medications? And before you say that, I'm going to shut the door, which I did, and close the curtain if necessary. Now, do you have any allergies? Perfect. Any medications, antiseptics, anything like that? Latex? Great. Okay. We are going to get ready to start. So first, I'm going to educate my patient that we're doing an IV, which is going to be a poke in your arm. I'm going to assure if they have any fears. Do you have any? No, great. I know needles can be kind of scary and pokey. And I'm going to make sure that everything looks good. And I will place like a waterproof pad under my patient. And I'm explaining that this IV is so we can put meds or hydration if they need it, and it can go in through their veins, which is a pretty quick way. And now that we are there, I'm going to come over here and I'm going to prep my area. So like I said, I'm going to put the waterproof pad. I would put my patient in low Fowlers. And I'm going to start by grabbing an alcohol wipe and getting things cleaned and ready. So first I'm going to flush this without leaking everywhere. Whoops. And then I'm going to grab a garbage, put that under me so I have that. And I'm going to grab this alcohol wipe and I'm going to clean the tip of this really well. Awesome. And I totally don't think I did, so I would redo all that, but if I forgot, I'm going to do hand hygiene, and then I would now grab this, excuse me, and I would clean this off. That way I have clean hands while doing it, and I'm maintaining aseptic technique. And then I would plug this in, and I'm going to make sure that it's unhooked so that I can flush my line really closely so that I don't have any bubbles, or at least as little of bubbles in my line. Now that that's ready, I'm going to set that here, and I'm going to have my tourniquet ready and an alcohol wipe for the skin. I've got some gauze ready to clean up any mess. And I'm going to open my needle but not uncap it as I'm not gloved or ready yet. So I'll set that there, and I'm going to open my Tegaderm so that that's ready as well. I already clarified with my patient that this is the preferred arm, and I'm going to ask him again, do you have any questions, concerns, anything that I can answer? They don't have anything right now, so I think I'm good. So I'll put this here so that it's ready to place on the patient as soon as I am ready. Okay, I think we're ready to start prepping the things. So I'm going to palpate for a good vein. I'm going to ask them to turn their arm over. Make sure that I have a strong vein. And this feels like a pretty strong one here. So I'm going to go with that one. So I'm going to put some gloves on. And I'm going to first start by sterilizing the area on the patient's skin with a alcohol prep pad. And I'm going to go in a circular motion going from the inside to the outside. And I'm going to let that dry for 30 seconds, so I'm going to place my tourniquet on my patient's arm. That way too, it's not on there for too long, because then it just gets uncomfortable. Okay. All right, we are ready to go ahead and poke the patient. Are you ready? Okay, wonderful. I have my sharp spin, so I'm ready for that as well. I'm gonna hold the skin taut, but I'm not going to touch where I've prepped specifically. I'm gonna insert on 3, 2, 1. I'm gonna look for a flash, which I got one. I'm gonna slowly insert this in while I pull the needle out. I'm gonna pull my tourniquet off and apply pressure. Put this in my sharp spin, and I'm going to connect that in. I'm gonna aspirate a little bit of fluid, make sure I'm getting good blood. I would mainly do this because in the newer catheters that are self-stopping, and this one isn't, but I will practice it. And then I'm gonna flush my line. All right, now I'm gonna clamp that off. And before I would have done that, I did hold it, but I do want to stick a tegaderm so it can't fall out. So I'm going to stick that tegaderm down nice and well. Make sure that it's stuck on all of the sides. Perfect. Okay, I'm going to unhook this. And I totally forgot to bring my tape over. I'm gonna grab it. Here's my roll of tape, and this is secure, so we are good to move. I'm gonna instruct my patient to hold really still, as we don't want to cause any injury until I can get it taped down and really secured. So I'm going to untape, if I can find where the tape ends. I would have done this before, so my patient wasn't waiting. Okay, that's a bad piece. And so I'm gonna grab this and I'm gonna wrap it around. I'm gonna start by taping over the one side directly onto the arm, and then while they hold their arms still, hold it nice and still for me. I'm going to grab another piece of tape that this tape does not want to work for me today. Like I said, in the future, I will definitely know to prep my tape beforehand. I don't know why this is being so difficult. That's probably why. Okay. Since I don't have any more tape, I'm going to use another tegaderm because that had more tape, but it didn't come off right and it ended up being out. So I would grab this, I would stick it here, and I would seal it down, making sure that every part of this is secured to my patient as best as possible. Alrighty, now I would make sure that my patient is comfortable, and I'm going to verbalize that I would label my initials, the date, and the time. And after I'm done with that, I'm going to take my gloves off. I throw my garbage away. I would throw this way as well. And then I'm going to lower my patient down to the lowest level and make sure that they are safe. I'm going to do hand hygiene and ask if they have any more questions, and they don't, so I'm going to go and document. I would come back and check in a little bit to make sure that everything still looks good. Thanks.